Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome back Dr. Sophia Shakur. You are a neurosurgeon, and you're from this area originally, and you're back working at Tidal Health as a neurosurgeon, and you would like to talk about the very mystical topic, I think many of us just don't understand exactly what it is, of artificial intelligence in healthcare.
Right, exactly. Thank you for having me back, and I'm happy to talk about this very interesting and current topic.
So I guess where we should start is tell us what artificial intelligence, or AI, you hear it called, is and how it was developed.
Sure, I think a lot of folks are sometimes confused about what artificial intelligence is. We hear about it a lot now in the media, but really it's quite simple. It's a technology that's based on computers. So as computers have been developed and as computers have gotten faster with calculations or analyzing data, they are now able to make human-like decisions about various things.
Is that scary in any way to you? Well, just the way you say it, I'm like, okay. You can see why the public is concerned to some degree.
Of course, but just like any technology, we do want to reap the benefits to help people and help the world.
I know, and that's one thing you want to focus on, is what are the benefits of using AI, particularly in medicine and healthcare in general.
Right. In the last several years, a lot of applications based on artificial intelligence have been developed for healthcare. Various things, interpreting radiology or medical imaging. Another application would be interpreting pathology results or pathology slides or specimens. Those are probably the uses currently used in healthcare.
And I guess that's because things can be picked up that the human eye cannot pick up?
Or perhaps the artificial intelligence technology can do it maybe better than a human being, more accurately, more quickly, more effectively.
So how would that be done at the hospital, say, when a specimen's received? I guess I'm just trying to wrap my mind around exactly what AI is doing or how it's used to achieve those results.
Right. So artificial intelligence, at least in healthcare, is usually a software program on a computer.
Okay.
So as long as we can send the information, the data, for the pathology specimen or for the medical imaging to that software program, it can analyze the data and give information or make an interpretation based on that information that it's gotten.
So then the radiologist or the pathologist or whatever uses that information to relay that information to the patient.
Correct.
Okay.
Or to other physicians.
Oh, okay.
You know, to the referring physicians, so that we can use that information to make medical decisions or to inform the patient.
I know this may go through people's minds, but how do we know for sure it is doing the right thing? How is this technology being validated for use?
Yeah, so just like a medication in healthcare, it goes through a rigorous process before it's actually used and applied to patients. So, you know, this technology that we're talking about for stroke, for example, has been studied by numerous groups in the world to ensure that the information that it's giving is accurate. You know, they compare it to traditional ways of interpreting imaging studies, and then they also validate and ensure that it's going to result in improved outcomes. So in both ways, the technology has been validated.
I know for drugs, you mentioned, the FDA oversees those. So I guess there is an overarching body that is monitoring this and making sure it's being used properly and that it works.
That's right. So this technology is FDA approved. I believe it was FDA approved around 2013. There are various companies that offer the technology, and each company does go through a rigorous approval process.
Okay, that's good to know.
Right.
Now, you are a neurosurgeon, so maybe give us some specific examples of how it's being used in your area of practice, say strokes. I know that's one of your areas of expertise.
Right. So within neurosurgery or neurology, currently the artificial intelligence technology is used most commonly for strokes. A stroke is where oftentimes a blood vessel, an artery in the brain gets blocked, so a certain part of the brain isn't receiving enough blood flow. Or sometimes a blood vessel ruptures or bursts in the brain, which can cause a hemorrhagic stroke. So there are two types of strokes, but right now it's being used mostly for identifying patients who have strokes where the blood vessel is blocked. And when it comes to a stroke, time is of the essence. So time is brain. So the more quickly we can identify, first off, a patient who is indeed having a stroke or who has a stroke that can be treated with surgery or with medications, it will help the patient and hopefully help them have a better outcome.
So you still are using a scan of some kind, a CAT scan or MRI, but it's a software package then that interprets the results more quickly and accurately.
Exactly. So the management or treatment of stroke patients is heavily based on imaging. So anything that we can do to save time to interpret the image will help the patient. So that's what the AI technology does. It's software that analyzes the image that's obtained in real time, and within a couple of minutes, it can send an interpretation of that scan to a physician such as myself so that we can make decisions regarding treatment for the patient.
So are you currently using this at Tidal Health?
Yes. So nationally and internationally, this kind of technology has been used for at least the last 5 years. And we started using it at Tidal Health Peninsula Regional and even Tidal Health Nanticoke about 4 years ago.
Oh, very good. That's exciting then.
Yeah, it's very current.
I didn't know. I think a lot of people don't realize that kind of technology is being used here on the shore.
Right. And what's great about the technology as well is the information can actually be sent to a mobile device such as your cell phone. So you don't have to physically be logged into an imaging system at the hospital to get the information about the patient. You really have it in the palm of your hands.
And that cuts down on time too, I take it?
Correct.
Very good. Any other examples in healthcare?
Oh, well, like we mentioned before, a lot of it is imaging-based or pathology-based. So physicians are using it not just to identify stroke patients, but also, for example, to identify patients who might have a blood clot in the lung, which can be a life-threatening problem, pulmonary embolism. They're also using it to help diagnose breast cancer. In other words, the artificial intelligence technology can look at perhaps a digital mammogram or an MRI to hopefully more accurately, and the early detection of breast cancer is very important. And then of course with pathology to hopefully make a more accurate diagnosis based on the specimen.
So it sounds like the big advantage is earlier, quicker, and it can be accessible in the palm of the physician's hand to go ahead and institute treatment more efficiently and sooner.
Exactly. And actually, the American Stroke Association has specific guidelines that are time-based, just with cardiology guidelines in terms of heart attacks.
Right.
So we have to meet certain guidelines within certain time parameters, and they always update the guidelines based on this new technology because the expectation is to keep up with this technology to offer treatments to patients even quicker.
And I know Tidal Health is recognized as a certified stroke center, correct? So keeping up with these guidelines would be helpful in that regard?
Exactly.
So what is the history of artificial intelligence?
Yeah, so artificial intelligence has only now become more commonly heard in the media and in public, but it was actually developed in the 1940s by a British mathematician, Alan Turing, who is considered to be the father of artificial intelligence and actually the father of the computer. So he and his team developed the first computer at that time, and since computers have developed and become much faster, the use of artificial intelligence in everyday life has become more common.
So let's talk about what AI doesn't do. I think many people would be worried or more afraid because of all the emphasis in the media about AI and could it possibly take over. What does it not do? Do we have to worry about AI like replacing physicians or providers?
Yeah, at least within the healthcare realm, it certainly does not replace a physician. So ultimately, a human being, a physician, is still making the final decision regarding how that information is going to be used for the patient's good. So AI technology helps interpret the information more quickly and gives a physician an idea what might be the best approach to a patient, but it certainly doesn't make the final decision or take the place of an actual physician's decision-making process.
Is this being integrated in medical school training these days now?
I hope so. I'm, somewhat far removed from medical school now, but I would expect that in the future, as the technology develops and as it's used more and more often in medicine, that it becomes part of their training.
Well, I guess when they're residents, I know Tidal Health now has medical residents at the hospital. They're seeing it in action, correct?
Correct. Yeah. So they have that firsthand exposure with how it's used directly in patient care.
All right, very good. I guess let's sum up and just, have you give your final thoughts on how does this technology help patients? And of course, at the end of the day, we're always interested in improving patient outcomes per se.
Right, because of the speed that we can get better and more accurate information, that's how it really helps patients and improves outcomes. Like I said, with a stroke, time is brain. So the quicker that we can make a decision and make the best treatment decision for that patient, whether they're going to receive a clot-busting medication or whether they're going to undergo a surgery to remove the clot, to open the artery. All of that can be done quicker and more accurately to identify which patients are going to benefit, and it's going to help their outcomes.
Well, thank you so much, Dr. Shakur. That certainly gives me a better understanding, and of course, hopefully our viewers will feel more positive about this technology, because I think it's gotten some bad press in some ways. But in healthcare, it sounds like it's making quite a positive impact.
Absolutely, that's right.
Well, thank you again for being on the program and explaining this intriguing topic. And we'll post some websites perhaps at the end of the program to give people a place to find more information on it.
Right. Thank you very much.
And thank you for joining us for this edition of Focus on Health here on PAC 14.